All right, good afternoon. So I'm excited to talk about the actual practical application of what you've been hearing about. And I think I'm going to share some of the information that you heard from David, or some of the examples that you heard from David. So I put together a very short presentation. I think it's only 231 slides. I did not number them. So I think we can get it done in about 15 minutes. So the first thing I want to take a look at are food deserts, and you've heard about that through the course of this morning and this afternoon. And food deserts have a low or no access to healthy food, lack of access to health care, challenges the public benefits access, lack of access to financial services. And I think that, the picture there says a lot. It says more than the words that are on the slide. I got my dinner from the gas station. And that's significant. That's really happening across the United States. And to the magnitude of 24.6 million Americans that live in food deserts. That's really a big number. Why does it matter? Well, it matters because when you don't have access to healthy food, you actually have higher incidences of heart disease, cancer, stroke, diabetes. So it really matters that we create access within these communities. So why the supermarket? Why do we say use the supermarket as the organization or the entity, the built environment to deliver these services? Number one is because it's a high traffic retail environment. It's a lot of people there. In a small grocery store, you'll get 1,000 people per day that go through that grocery store. In some of the larger, you'll get 50,000 people a week that come through a grocery store. That's significant. And so it poses a great opportunity to make a significant impact. Also, relevance. So when we think about what we're trying to accomplish here, especially as it relates to obesity and nutrition-related disease, you are in the right environment. So you have food that's there. And you want to promote healthy eating, you want to promote good health, it's in the right environment. And then accessibility. And a lot of times when supermarkets are built, you not only look at just the physical structure of the supermarket, but you look at the roads, you look at public transportation. So here's an environment that's actually built to create an opportunity for people to get to it. So you have a high traffic environment, a lot of people coming there, and the appropriate relevance. So let's talk about that, and let's talk about what happens within this environment. So there's a focus on fresh. So it's aesthetically pleasing, wide selection, and respect for the individual. So I want to talk about this, the last bullet point for a second, the respect of the individual. And you heard about that, and I think in one of the in the earlier presentations within this panel, and it was really about, it was the quote, and I haven't memorized the quote yet from the Harvard professor. I tried, but it just didn't work out. It was, it was like more than 4 words. So, but what he talked about was that in underserved communities or communities of color, that they're disproportionately impacted. And a lot of times when you have supermarkets that's built within those communities, they reflect that. They reflect the biases of that community. And what I mean is that they're not clean. They don't have good produce. They're not merchandised the right way. And so when you look here at some of the work that we do at UpLift, it's really about building environments that respect the community and the individuals that are there. One of the other things that you heard about in the presentation that David made was about engaging the local community and place matters. We engage local farmers. So how can we bring local farmers into the large supermarket? It's being really proactive in bringing their produce in. And it also helps to reduce the carbon footprint as well. A focus on culture. So here we look at what other things can you do and bring it to the supermarket to strengthen your relationship with the neighborhood. And it's number one, understanding their neighborhood. And this is an example of a neighborhood that has a high Muslim population. So we brought halal into the store. So again, it's respect for the culture. Good food that impacts health outcomes. So I want to talk about this a little bit more in detail. So you see here we created a theater to ultimately change behavior for the individuals there. So this actually exists in a neighborhood that is predominantly African American, predominantly from the South. And so we're going to use some stereotypes here, if it's okay, if you bear with me for a second. But predominantly African American, predominantly from the South. Think about fried chicken, maybe? Well, it's absolutely true. And so initially, there was a good deal of fried chicken that was sold in a store. It was actually about 90% of all of the prepared chicken sales in the store. So we looked at how could we shift that behavior to a more, a healthier food, and we looked at creating basically a stage or a theater to cook the food in. And so what you see here is fried grilled chicken is chicken that's actually been butterflied and is put on a grill. So it's healthier than the fried chicken. The smells are actually pumped through the store, so you smell it as you come in. And it's prepared the fried chicken sales by 90% within the store. So this is talking about making an impact and way entrepreneurs can make an impact. And then ultimately, it made a financial impact for the entrepreneur that implemented it as well. So I want to get into now the healthcare. And you've heard about healthcare interventions. And we actually work to bring healthcare into the supermarket. So we'll work with a supermarket operator to create space. Then we'll go out and work with a federally qualified healthcare center to occupy that space and deliver services. And then we'll also work with that federally qualified health center not only to provide urgent care, but a blended service model, which is between urgent care and primary care. So it's not just seeing the sick when they're sick, but how can we actually move you in the system? And then obviously you see that they serve Medicaid and uninsured, because in underserved communities and food deserts, that's what you see a lot of. Health and nutrition education. Again, we talked about the relevance of the supermarket. Here's an opportunity to actually create behavioral change right in the supermarket. It's an appropriate environment, and it's no cost to the participant. And then ultimately, financial services. So here's an opportunity to develop financial relationships. There's no minimum balance, no monthly service fees, and all consumer products. So it's not just limited to the products that we think would be good for that community, but for all communities alike. Now the questions become, well, why don't all entrepreneurs do this, right? Or how can entrepreneurs afford to do this? Well, all of these services, and I'll go through it, have a symbiotic relationship with the grocer. So we think about that. We go back to the healthcare aspect of it. Well, the health clinic actually pays rent to the entrepreneur, which is great. The entrepreneur receives rent. The other piece of it too, when we think about the health clinic and the health services, is that they actually promote good health. Well, entrepreneurs in supermarkets actually sell health and beauty aids, so you get to sell more health and beauty aids. It also changes behavior from purchasing processed foods to moving to a healthy food, so you're selling more produce in those stores. Financial services. By opening checking accounts, it allows individuals to save more money. It allows individuals to borrow money, which would allow them to be more vested in the store and actually spend more money in the store. So they have this relationship. Engaging local entrepreneurs. And you heard this earlier. So here's an opportunity to actually develop local entrepreneurs within a store. So here's an example of a gentleman by the name of Dre. So Andre was selling water ice in the front of the store out of a little vending cart. And the store's leadership loved the water ice and said, well, how about ice cream? Would you be interested in selling ice cream? And the operator actually invested in the entrepreneur to develop an ice cream line. And so you see here strawberry shortcake, which is appropriate for the community that it's in. But he also developed sweet potato pie, banana pudding ice cream. And so he had all of these culturally relevant flavors that he created where the entrepreneur helped to develop this for him. And then ultimately, the entrepreneur put his product in the store. So it was a win-win for both the entrepreneur and the individual here, the younger entrepreneur, the micro business. And then what you'll also find is within this one store that I'm highlighting, there's 40 entrepreneurs or micro businesses that exist within that. And so these are these win-win relationships that are created within the store. Here's something that's also important. And you heard earlier about workforce and workforce development. And we talked about kind of the easy to employ, the college educated, those with stackable certifications. Here is a workforce that is a little bit harder to employ, the formerly incarcerated. And here's an opportunity for entrepreneurs to actually bring them in to the business. And it actually you have to change your mindset and look at, as opposed to looking at what they did, focus on the skills that they actually bring. Engaging the individual and providing a positive alternative for these individuals. So it's interesting, I'll share something to you. And one of the entrepreneurs, the chairman of my board that owns a number of ShopRights, he gets up and he tells this story about engaging ex-offenders or reentering citizens. And what he says is that drug dealers make the best employees, right? So at first glance, it's like, whoa, wait, okay, let's talk about that. And what he talks about when he says this is that you have a population of people that possess a skill set that he can use. And so what he talks about is that drug dealers, they understand margins. Well, in the grocery business, you need to understand margins. They understand business, they understand marketing, they understand branding, they understand how, in some cases, to lead other people. And so these are skill sets that were, misapplied at one point, but you now leverage in a new business. And so how do we look at them differently to be able to leverage them? And then what he also talks about is that the ex-offenders are actually his best employees because they actually commit less theft. They show up more often because it's a second chance for them. Whereas, they don't want to go back to jail. They don't want to go back and repeat the same things that they repeated, those same issues. So they actually want to do the right thing. So they actually make great employees. So this all sounds well and good, right? It sounds like everyone should be doing this. Every grocery store operator, I can bring someone in and make rent on it. I can get another organization to come in and sell more of my products. I can help to support budding entrepreneurs and sell their products in the store. I can invest in them, and that investment may actually drive additional revenue through venture capital that I may put into this. But there has to be something here that's preventing this from happening. And it's because it has a high failure rate. So let's talk about that a little bit in the last couple of minutes that I have. In the industry, there's a high consolidation. And basically what that means is supermarkets are moving out of food deserts and urban environments. They're moving more to the middle income neighborhoods. There's a lack of access to capital. There's a lack of access to sustainable operating strategies. There's issues with workforce and training, and then community adoption and support. So how do we solve for this? So the way we solve for this is looking more towards social entrepreneurism versus what we've had in the past. And I'll go to my extreme. So if you look at the far left, you see the philanthropic support. Those are your nonprofits that focus on just foundation support. And then you have your for-profits that want to maximize profit. What we propose here is actually looking at the middle section of social entrepreneurism, where we have for nonprofits, earned income strategies, which UpLift is one of those nonprofits. And then for the entrepreneur on the for-profit side, looking at mission-driven strategies. So I want to do this because it's the right thing to do. I want to have a healthcare clinic because it's the right thing to do. I want to have a financial services institution because it's the right thing to do. And so here's part of the problem. Grocery has a very thin margin, and it's about 1% for the average grocer in middle income neighborhoods. When you go into low income or food deserts, you actually have a 4% loss because of the buying habits of the individual shopping there. And then also you lose the 1% that you would normally gain, so you have a 5% financial gap. So how do you solve for that? So you leverage smart public incentives, And then entrepreneur solutions, which I covered before, bringing other things in. And in the last 24 seconds, let's see if I can do it. Leveraging smart public incentives is where we talk about bringing the government in. And here we look at one-time incentives versus ongoing incentives. So leveraging new market tax credits, redevelopment assistance capital programs for states, whereas you don't have to continually rely on the government to come in, but can we do it, at one time? So I want to thank you for your time, and it just turned red. So there we go.